Hello everybody, I'm Dr. Tanvi Sood. I'm consultant medical oncologist at Paras Cancer Center, Gurugram. And today we are here to talk about some common myths and bust these myths about cancer and to address some issues that patients generally talk to us about on a daily basis in the OPD. So just to start off, just to give a context about cancer and what is the need of having this discussion today, cancer burden is steadily increasing, not just in worldwide, but also in India today. And you would be surprised to know that about 70% of these cancers are due to preventable lifestyle factors. So why is it so important to talk about cancer today? The mortality is increasing, the morbidity is increasing, but it is not just a health concern. It is also a social concern. It is also an economic concern. So we have to address cancer, which when detected in early stages can be curable also, and early detection can save many lives. So let's talk a little bit about what is breast cancer, what is the incidence of breast cancer, and what are the common ways in which you can be aware about breast cancer. So breast cancer in today's date in India, 1 in every 8 women are getting diagnosis of breast cancer. How can we be aware of breast cancer and how do we know what are those common risk factors by which I know is my risk more as compared to somebody else? Who are these women who are more at risk? So it is common knowledge that as the age increases, the chances of breast cancer also increases. There are certain factors that are out of our hands that we cannot modify, like genetic risk of the family, genetic risk of women in that family, men in that family who can have breast cancer, increasing age, advancing age, old age. These are things that are not in our control and not in our hands. Whether there is any previous history of any treatments, hormonal treatment, any radiation exposure that can also increase the chances of breast cancer. But what are certain factors that are in our hands, in our control, that we can be made aware of in order to prevent the occurrence of breast cancer? The most important are lifestyle related, as we would have obviously guessed already. Many cancers are related to obesity, weight gain, and also the kind of food we consume, as related to what are we having more red meat consumption, more alcohol consumption in our food, fats are more in our food. So these are certain common things that we should be aware of, that studies have proven there is a correlation with increased chances of cancer and specifically breast cancers. So women want to know, how do I know that I have a lump that could be cancerous? Now, first and foremost important thing that we want to tell all our viewers is every lump is not a cancer. So we should not panic, but yes, we should be breast aware. So these days we use the term breast aware. Why? Because women should be aware of how normally their breasts seem. They should take help of practitioners, they should come to clinicians and experts and have regular examinations also, who can guide them how to do self-breast examination. So something very simple that I want to highlight is something like a cancer screening is in our hands that we can use as a modality to catch these cancers fast. And if any lump is there, if it is a painless lump, if there is a change in shape of the breast, if there is any abnormal discharge coming from that breast, if there is any thickening of the skin of the breast, like any abnormal thickening, like a puckered appearance, which we commonly say looks like an orange peel appearance, something like this is happening, you should immediately alert the physician and go and meet a doctor for examination. Also, apart from examinations, there are other tests that we should be aware of. All women above the age of 40 should get mammograms done every year. So this is something that we tell almost every woman who walks through the door, be it for any concern. We should talk about it amongst our family members, discuss it with our older people in the family, and also be aware for ourselves that something as simple as a mammogram, which is nothing but X-ray of the breast, or an ultrasonogram, which is nothing but ultrasound of the breast, can help us in detecting these lesions in an early stage, which can also be curable. So now I'm going to address some common myths that surround cancers and also breast cancers. So question number 1, commonly I get asked, can antiperspirants, which are also commonly known as deodorants, can application of these sprays increase the chances of breast cancer or axillary lumps? So the simple answer is no, it cannot happen. There is enough research out there, enough data out there that these sprays, they contain some chemicals like aluminium based and fragrance, and all of these may even have talc, but they don't have any direct correlation to development of breast cancers. So you can safely use these antiperspirants and not have concern that this is what can lead to development of breast cancer. Another question I get asked about is about lead in the cosmetics that we get over the counter, especially that are economically available, whether for example lipsticks or any lotions, creams, do they contain lead, and if they can cause cancer. So I will put it simply, anything in excess is bad. Lead in excess, where there are activities like mining, smelting, where people are exposed to it in higher amounts, that has shown that there is correlation of cancer production. But cosmetics which have very low levels of lead, in fact it is present even in our surrounding and environment in that much amount, these do not cause cancer directly. So no, cosmetics do not cause you harm and will not cause cancer directly. Now you must be wondering if refined sugar causes cancer. So this is an extremely important question to address, because even people who are on treatment for cancer, even they ask us should they reduce sugar in their diet. So simple answer to this is that we have enough research to show there is no direct correlation of refined sugar and the process by which it gets refined that can cause cancer in our body. However, that being said, there is an indirect implication also. Obesity, diabetes, lifestyle problems, these can cause cancer. Excess of sugar, uncontrolled diabetes, these factors can indirectly cause cancer somewhere along the line. However, refined sugar does not directly cause cancers. Many people wonder if moles that we find on our body, whether all these moles should be removed and all of them can turn into cancers. So that is also a myth. Actually speaking, moles can be very harmless. However, there are some warning signs that we should be aware of. When a mole is changing size, when it is changing color, or it appears irritated, or if the mole is even bleeding, these are all warning signs and we should immediately go to a dermatologist and have it addressed. Preferably completely removed, and it should be checked in the pathology lab if any abnormality is there. Apart from this, every mole is not cancerous. It is merely an harmless freckle on the body. Now coming to a very important question. What about red meat? What about non-veg? What about grilled meats? So yes, these products of food have been shown to have a direct correlation to causing cancer, specifically cancers of the colorectum. That means the gastrointestinal tract. So charred meats, smoked meats, burnt meats, grilled meats, all of these, they create a chemical which can have a carcinogenic effect. So it is advisable to avoid such things in your diet, because enough studies have proven that these can long-term consumption of these meats can cause cancer. So another question about hair dye usage. Can hair dye usage cause brain cancers or skin cancers? Because we all know that hair dye, they contain chemicals. However, the answer to this is also no. There is no data to implicate that hair dyes can cause cancer directly. Earlier, there were a lot of rumors that breast cancer can happen by hair dye and skin cancer can happen by hair dye, even brain cancers. However, there is no truth to it till date. There is no data that shows that hair dye usage can cause increased chances of developing cancer. So some people, they come to OPD and they wonder if they have hair loss, they have excessive hair loss. Could it be because they have cancer in their body and it is somehow a symptom of carrying cancer? However, that is not true. So hair loss is not a symptom of cancer. However, many cancer treatments can cause hair loss. So it can be something related to cancer treatment. However, in regular patients, regular people who don't have any cancer, not undergoing any treatment, if they have hair loss, it could be something related to their hormone changes, or maybe a change in food, their diet, some protein deficiencies, or it could also be some medicine that they have recently started taking, some hormonal disorders like thyroid problems, or even diabetes for that matter. However, hair loss does not mean that there could also be cancer in the body. And now the last question. So this is a very important question to address. A lot of people think that breast cancer can happen only in women. Now this has to be the biggest myth, because breast cancer is more common in women, but let's not forget that it can also happen in men. No doubt it is rare, because maybe only 1% of breast cancers are seen in men. However, there is genetic tendency, certain syndromes in which even men can develop breast cancer, and if they feel any lump in the chest, under the nipple area, they should immediately report to a doctor for examination. So now we've come to the end of our list of questions and certain myths that we have frequently encountered in OPD and general conversations. If there is any other question that I have missed out, I would be very open to receiving feedback, and you can get in touch with us and let us know what is it that we can help you with and understand. But the most important thing that we should know about is the prevention aspect of cancer and the screening aspect of cancer, and as basic as lifestyle modification, something that we are in control of. So let's talk more about it. It is not a taboo. It should not be a fearful topic. We should involve the elders in the family, talk about it with family, and even come to the hospital and speak to our doctor. When you get routine tests done, we should also incorporate screening tests like mammographies, like colonoscopies, like even pap smears for women. So do get in touch with your doctors, with your physicians, with your gynecologists, and understand how you can even have cancer screening and prevention strategies as part of your routine tests. So most importantly, we have to remember that early detection saves lives, and the more you come forth and talk about it will empower us to fight it together. Thank you.